My name is Dr. Christine Morrison, and I'm the director of the Extramural Research Program Office that serves the 3 national infectious disease centers at CDC. And at the time that the invention was developed, I was the chief of the Diagnostic Development Laboratory in the Mycotic Diseases branch at CDC. The technology addresses the diagnosis of vulvovaginal candidiasis, or VVC for short. And VVC is caused by Candida species, which are fungi, and sometimes you'll hear it referred to as a yeast infection. Candida are normally part of the flora that's on your skin and mucous membranes, but they're held in check because you have a healthy immune system. However, Candida can overgrow if people take broad-spectrum antibacterial antibiotics to which Candida are not susceptible, or if women use high-dose estrogen oral contraceptives or have hormone replacement therapy. Also, uncontrolled diabetes or pregnancy or a weakened immune system can make one susceptible to the overgrowth of the Candida and symptoms. And the symptoms of candidiasis are pain, soreness, itching, burning, abnormal discharge, vaginal discharge, painful intercourse. And unfortunately, many of those symptoms are very similar to other genital infections, so making a diagnosis on symptoms alone is not adequate. And traditionally, diagnosis was made by putting a sample of vaginal fluid on a glass slide and looking at it microscopically. But this is very nonspecific because Candida can be part of the normal vaginal tract. Also, you could culture the organism, but that would take time and there'd be a delay in treatment, and that's also nonspecific, again, because of its natural habitat in the vagina. There was a great need to have a new test that could be sensitive and specific and diagnose not only Candida, but also differentiate it from other genital infections. Because roughly 50 to 75% of women with a healthy immune system will get at least one episode of VVC in their lifetime, and a subset of those women will have multiple episodes, recurrent episodes that are severe or drug resistant. So that's what we were trying to address with our test. The internal transcribed spacer region, or ITS region, of Candida DNA had already been sequenced for a different purpose. But I got the idea that because there's so much variability in that region of the DNA, that we could use it as a diagnostic test to not only detect Candida, but also differentiate between different Candida species. The true art of the discovery was that we were able to put mismatches in that sequence in the proper proportion so that we could still identify the target Candida species, but not have any cross-reactivity with other Candida species. And by adding this test to a panel that Quest Diagnostics had developed for bacterial, viral, and protozoal vaginal infections, we were able to have a panel that we could have a specific and sensitive test and differentiate between all of those different types of vaginal infections and give the appropriate therapy.